upper GI. I have thin barium, thick barium, or 6 ounces, a cup and a straw, some gas crystals, some barium tablets if the radiologist wants to use that, a pillow, a compression paddle, a gown for the patient, a shield, and a 45-degree sponge. Then I also have the lead gloves over there on the wall if the radiologist wants to use those. And then I have a table in the upright position for the beginning of the exam. I'm going to go get my patient now. Keely? Hi, I'm Joey, and I'll be helping with your exam today. Okay. Can I have your full name and your date of birth? Okay. Is there any possibility of pregnancy? No. All right. Can you tell me a little bit about what's been going on today?
My stomach has just been hurting these few days.
Okay. All right. Have you had any surgeries on your esophagus or your stomach? No. Or have you had any scopes? No. All right. When was the last time that you ate? Just last night? All right. Have you had any teething products or chewing gum? No. All right. So I'll tell you a little bit. Have you had this exam done before? No. All right. So we're gonna have you drink some barium. It's thick and chalky. He will probably give you some gas crystals. Those will just make your esophagus and your stomach easier to see, and it might make you feel like you need to burp, but try to wait till the end. And then we have some barium tablets, and we might not give you those, but that's just kind of like swallowing a pill. So I will have you take off any metal and including your bra, and I will have you put this down on. The open side goes towards the back. Alright, so you can go ahead and stand up there and put your back up against the board for me. Alright, so now the radiologist would come in and do the exam, and he might have her move in different positions. If you put the table down, he might have her roll around a couple of times. And then after that, he ordered some overhead, so that's what I'm going to be doing. Alright, I'm just going to lower the table here. Alright, before I put it all the way down, I'm going to give her a pillow. My IR is already lined up and tracking the tube. So the first one will be the LPO. Keely, I'll just have you roll up onto your left side, and you're going to put the sponge under you. You can roll back. All right. Yep, just like that. All right, so the centering point is between the xiphoid and the lower margin of the ribs. And then halfway between the mid-sagittal plane and the lateral side of the rib. We're going to put a left marker on her. And the obliquity is 30 to 60 degrees. All right. The technique is 15 at 110. All right, Keely, go ahead and take a deep breath in for me. Blow it all the way out. Stop breathing. Exposure. You can breathe. All right, I can take this sponge from you. Okay. And you can lay on your back. For this one, we see the duodenal bulb and the pylorus not superimposed. All right, I can take my marker, this, and then you can go ahead and lay on your right side for me. Feel on your shoulders here. Okay. That's good. Alright, so this one is 2 inches above the inferior border of the ribs. And then on the anterior third of the abdomen.
Okay. I'll have you just bring your arms up just a little more for me. Okay.
And I'm gonna use my right marker because it's a right lateral. And put on the shield. Alright. Technique for this one is 30 at 110. Alright, Keely, I'll have you go ahead and take a deep breath in. Blow it all the way out. Stop breathing. Exposure, you can breathe. Alright, so on this one, you see you should see a true lateral, and you can check that by the vertebrae. Alright, so on this last one, I'll have you roll onto your stomach for me. And I'm actually going to slide this in here, and then you can lay on that. And then, yep, that arm can go down. So this one is also between the xiphoid and the lower border of the ribs. So I'm going to go off her scapula and go a little bit from the inferior border there. Okay. And this one is also between the vertebrae, or the spine, and the lateral side of the body. I'm using a right marker because this is RAO. Technique for this one is 15 at 110. Alright, Keely, go ahead and take a deep breath in. Blow it all the way out. Stop breathing. Exposure, you can breathe. So on this one, we should see the duodenal bulb and the pylorus in profile. Alright, I'm going to take your sponge and you can go ahead and lay flat on your stomach. Okay. So this last one is 2 inches above her inferior border of her ribs. And then it is a inch from the spine to the left. Technique for this one is also 15 at 110. Okay, Keely, go ahead and take a deep breath in. Blow it all the way out. stop breathing, exposure, you can breathe.
Okay.
And then on this one, you should see the entire stomach and the duodenal. Alright, so I'm going to go check my images with the radiologist, send those to the radiologist, and it looks like we have everything we need, so you can sit up. I'm going to actually move this out of the way really quick. You don't need to. And watch out behind you guys. Alright, you can go ahead and change back into your things.
Okay.
And then for the next couple days, I want you to really stay hydrated, be drinking a lot of water, and you can be taking some high fiber foods. If your doctor has prescribed a laxative, be sure to take that. This can cause constipation, so if you don't have a bowel movement in the next couple days, talk to your physician.
Okay.
And it goes in white, so it'll come out white, so don't be surprised. Do you have any questions?
No, I don't think so.
Alright, I can take you out. Thank you.